Hello! Today we will be discussing homeless refugees with substance use disorder and the environmental and cultural factors that impact this population. The members of our group are Emily Harames, Marianne Daniels, Rachel Heaps, and Annika Ferlin. And because this population is a very specific population, some of the information throughout this presentation is focused on one aspect of the population, but all of the things outlined in this presentation affect this population because of the complexity and the differences in the population. So to start, we're going to talk about how the media portrays this group. So media likes to portray drugs as addictive, hard to resist, violence, and all of these things can create a stigma surrounding this population. However, this kind of viewpoint of being homeless and doing drugs is inaccurate because there is hope for these individuals if we give them the right support. And the stigma and discriminatory attitudes towards this population can really harm them. Discrimination and stigma regarding being a refugee, being homeless, and using drugs can cause these people to feel shame, guilt, anger, and all of these things can make it more difficult for these patients and this population to find the help and the hope that they need, and can further cause their substance use to become worse. As far as family support is super essential to recovery from drug usage. Family support in this population is difficult because they may or may not have their family present. As a refugee, they may have left their family in whatever country they came from. This can lead to guilt and frustration surrounding the separation of their family. Addicts may continue to further use drugs as they are trying to cope with and avoid the situation that they're in, and it can make it difficult to have that familiar support. If a family is trying to stay involved, sometimes unhealthy roles can form, and family issues can create triggers, and drug usage can be perpetuated. And so it's important to address the family support aspect, and that may be more difficult in a refugee population because their family support may not look the same as other populations. The role of peers. So having supportive peers is important, especially in teens who are prone to risky behavior. This can lead to long-term dysfunctionality, which spills into adulthood. That can create homelessness and poor health outcomes. So this is talking more specifically about drug usage. However, the role of peers is also important for recovery of drug usage and for homeless refugees in general. Having support from their peers and from society in general to better their situation is critical. The cyclical nature. This population has a vulnerability and a cyclical nature. Drug relapse is more likely to occur in people facing homelessness. This means that even if people who say they're able to get clean off of the substances that they've been using, if they are still homeless because they haven't been able to find housing as a refugee, they're more likely to relapse on drugs. Refugees may also face barriers such as language barriers, which makes improvement of their situation difficult. If they're unable to work or to get out of their situation, it may turn into a cyclical nature, and it may even become generational. If they are unable to better their situation because they are homeless refugees and they're struggling with that drug addiction and they don't have the support that they need, it may continue to be a cycle and may continue to cause further harm in their life. The current legal system has laws and programs in place that can help this population. The first one is the Utah Department of Workforce Services. They have an entire refugee department, which is set up to provide assistance in finding housing, employment. They have resources such as substance abuse counseling. They have all of these resources available to help these refugees be able to find housing, be able to start their new lives here in Utah, and benefit from them. Salt Lake County also provides counseling services for homeless individuals to receive substance abuse treatment. So even if a homeless person is not a refugee, they can go to Salt Lake County and receive counseling services for their substance use, which can help them be able to get out of their situation and improve their lives. And while these services are available, laws regarding illicit substance use may inhibit treatment of this population. So there are laws that maybe negatively impact people who are using illicit substances, and this could lead to fear, especially in people who do not understand in receiving treatment for fear of being either arrested or punished for their substance use. Potential barriers to this population. The biggest barrier is going to be not having knowledge of where to go to get help and what services are available. Areas may also not have an adequate amount of treatment centers available. This happens often in rural areas, and so there may not be enough treatment in the area to provide treatment for all the people who need it. They may have had a previous negative experience with healthcare services. There's an increased likelihood of a substance user to not seek care if they've had a prior negative experience. They may also be afraid that they cannot afford treatment. They may be unable to provide, they might not have safe or sufficient housing, which can create a lot of strain to their ability to improve their situation. And they might not be able to afford transportation to get to the places where they can receive treatment or receive these help and services. On an international scope, the United Nations and national counts estimate is that there's an increase in homelessness in developing countries in the last 30 years, which can be a result of climate change, civil unrest, and global uncertainties. So they do have programs available internationally that are working to reduce the number of homelessness internationally through advocating for program interventions and improving local communities. But it is an international problem. Socioeconomic status also has a significant impact on this population. Refugees are already a vulnerable population due to uncertainty and adversity during the migration process. So while they may have a high socioeconomic status wherever they are coming from, when they are forced to flee their country and move somewhere else, they may have a low socioeconomic status wherever they get to, and this can create barriers to the types of care that they receive and to the type of life that they can lead. And then minorities also face social factors that adversely affect their health and can contribute to drug usage. And so oftentimes refugees are minorities, and these social factors can impact their health and can contribute to the drug usage itself. And so it is important to address these socioeconomic status issues when caring for this population. This section is on race and ethnicity. Racial and ethnic minorities suffer disproportionately poor health outcomes and lack of access to healthcare. Again, the language barrier in this population can make it difficult for them to access resources. There are health risks associated to those who are homeless, and those risks are different for white populations versus non-white populations. And so those risks are higher. Black homeless adults experience lower rates of alcohol abuse and psychiatric problems than white homeless adults, but they have higher rates of drug abuse. And so this population, specifically looking at illicit drug use, it may be more prevalent in Black homeless adults. And so race and ethnicity can play a factor in this population. Religion can also have an impact on the situation. Negative religious experiences can lead to drug use. Some examples of that are like clergy, sexual abuse, a history of sexual abuse that way, or social pressures. Faith and religion can be powerful and integral and really helpful in the recovery process as well, however. AA is a good example of that. They really emphasize the presence of a God or a higher power. The majority of addiction treatment programs in the US do include a spiritual based element, and so belief in a higher power is important to that recovery. And then spiritual beliefs and practices do lead to lower levels of substance abuse and reduced likelihood of using various drugs over the course of a lifetime. And so religion can have a negative impact, but it also can have a very powerful impact in the lives of these of this population. Gender can also have an impact on this population. For women, programs may not accept their children, and especially if they are homeless refugees, they may be here with their children, and they may not be able to receive the treatment that they need. Women may have more complex clinical needs, have difficulty finding childcare. They may not meet all of the women's needs, and women also have a greater history of sexual and physical abuse, which can lead to substance abuse and mental health problems, and so this can also play a significant factor. In men, drug use is more likely to lead to emergency room visits and overdose deaths. Men are almost 2 times more likely to die from, are 2 times more likely to binge drink than women. They have higher rates of alcohol-related hospitalizations, and they're also 3 times as likely to die by suicide than females, and are more likely to have been drinking prior to suicide. And so there are significant factors that impact both genders in this population, and treatment is needed to focus and to meet these specific needs of this population. Geographical location can also impact this population. If refugees are living in a rural community as opposed to the city, they may not have access to the types of treatment in proximity to them. In Utah specifically, the majority of refugee services, as well as substance abuse services and homelessness services, are based in Salt Lake City. However, Utah has a large area, and so people living in more rural areas, even living in Weber County, may not have as much access to the types of services that they need and would have to travel to Salt Lake City to receive those services. Living in an economically disadvantaged community can also continue to lead to difficulties for this population. Bias can also lead to problems for this community. The homeless population experience both personal and economic difficulties simply based on their housing status. They have implicit and explicit biases in their daily lives. Some examples of implicit biases might be a business that doesn't provide translation to the refugee's native language, which makes it more difficult for communication. Or an explicit bias can be seen when a refugee is denied entrance to an establishment based on their nationality or their housing status. On an international scope, health disparities, homeless refugees face numerous health issues, including HIV/AIDS, lung disease, malnutrition, mental health problems, substance use problems, and wounds and skin infections. These health disparities can be seen in the homeless population on an international level. And then these are our references here. Thank you guys so much for listening to our presentation.